Before entering the patient's room, you will ensure that there is not a precaution sign out the door indicating that you should be wearing any sort of PPE, like a gown, gloves, or a face mask before entering the room. Hi, my name is Julia. I'm going to be the student nurse today. Today we will be doing a head-to-toe assessment in which I will be inspecting, palpating, and auscultating different parts of your body. Is this okay?
Yes.
Okay, now before I get started, I'm going to wash my hands to prevent the spread of infection, and I'm going to identify my patient with 2 patient identifiers. Can I have your name and date of birth as I verify with your wristband?
Maylene Valdez, August 28, 2002.
Okay, perfect. Okay, I'm going to ask you a couple of routine questions. Do you know where you are today?
The hospital.
And what's the reason for you coming into the hospital today?
A checkup.
Okay, do you know who the President of the United States is?
Donald Trump.
So the patient is awake, alert, and oriented ×4 to person, place, time, and situation. I can tell that the patient is calm and cooperative. They're not showing any signs of distress. Her facial features seem symmetrical. The patient appears the stated age. Their skin color is appropriate for ethnicity. Their clothes are appropriate for the climate. Appears clean and well groomed. The patient maintains eye contact with me the whole time that we're speaking. Next, I will be taking the vital signs, which includes the blood pressure, the temperature, the pulse, the respirations, and pulse oximetry.
Please.
I will be taking the patient's pulse for 30 seconds, looking at the seconds hand on my watch, and for the other 30 seconds of a full minute without telling the patient so that they don't control their breathing, I'll be looking at the patient's respirations. So now I will be doing the 5th vital sign, which is pain, and I'm going to be using the numerical scale based on her age. So on a scale from 0 to 10, 10 being the worst pain imaginable, how much pain are you in right now?
0.
So now we will be doing the hair assessment, in which I will be looking for any lumps, lesions, or any signs of alopecia, which are balding spots. I'm also looking at the hair to make sure it's healthy, and I know that it's healthy because it is shiny and it's not coarse. Be looking at the eyes, in which I will be observing the sclera of the eye, which is the white part of the eye, as well as the conjunctiva. I'm going to have the patient pull down on the conjunctiva, and it should be pink. So I'm going to have the patient stare right ahead, and I'm going to be looking for their pupils accommodating to the light. Have you follow the pen line with your eyes, and what I'm going to be doing is the 6 cardinal fields of gaze, and this is the H method. Okay, and I'll keep following the pen line. So we just assessed for perla, which is P-E-R-R-L-A, and this means the pupils are equal, round, and reactive to light, and they accommodate, and they do. And now we're going to be doing the nose assessment. So we're going to be looking for any nasal drainage and any deviation, and we're also going to be observing for patency. So I'm going to have the patient put their finger on one nostril and then do the other side. Now I will also be observing the ears for any abnormal drainage, and I don't see any. And she is responding to me, so I can assess that she can hear me. Now I'm going to have you go as you open your mouth. Okay, and now I'm going to be observing her mouth. I'm going to be observing to make sure and that her gums are pink and her mucous membranes are moist. I'm going to be observing the neck to make sure that the trachea is midline. If it was deviated, this could be indicative of a pneumothorax. I'm also going to be observing for jugular vein distension, and first I'm going to have the patient turn to the side, and I'm observing that the jugular vein is not popping out. This could be seen in heart failure. I'm going to be auscultating with my stethoscope. With the bell side, I'm going to be listening to her carotid. And what I'm listening for is a bruit, which is a swooshing sound, which would be indicative of some sort of occlusion happening in the carotid artery. I'm going to be observing the skin. As I stated before, her skin is uniform and it's appropriate for ethnicity. But I will also be now palpating with the dorsal side of my hand for skin temperature. And it should feel nice and warm, and it does. I don't see any missing hair on her arms. I don't see any bruises or any lumps or any lesions on her skin. So you're looking at the patient's skin. You can be observing if they have an IV. Now this patient does not have an IV, but if they had an IV placed, you're going to be assessing for any signs of infiltration, which will be any purulent draining. You're going to also be observing to make sure that this is not bleeding and assess for patency. And you can also check the IV bag to make sure that it is running, and it is running at the right rate. So now I'm going to be checking for skin turgor, and I'm going to be tensing the skin and observing to make sure that it returns back to normal. This is a check for hydration status. If it goes back to normal, quickly, then this means that the patient is adequately hydrated. Next, I will be assessing for capillary refill, which I will be pinching the nail, and I'm watching. Now I'm going to be doing the cardiac assessment. I've already assessed the carotid artery in the neck assessment, so I will be needing my stethoscope again, but this time I'm going to be using the diaphragm part. I will be listening to the 5 landmarks. This is the aortic, pulmonic, Erb's point, tricuspid, and the mitral, which is also where you would feel the apical pulse that you have to feel for a minute. Now I will be doing the lung assessment, in which you need your stethoscope again, and you'll be listening with the diaphragm part, having the patient breathe in and out each time the stethoscope is on them. And you're gonna have if the patient is able to sit up, you're gonna auscultate the lungs in the back as well. Now it's important to compare both sides. Make sure you're doing it the right way. I will be doing the abdominal assessment. So first I have to ask time they had a bowel movement, and when was the last time they voided? When was the last time you used the restroom to do number 1?
Can I say that?
Yeah. When was the last time you used the restroom to do number 1?
5 minutes ago.
And have you gone to the restroom today to do number 2?
Yes.
This morning?
Yes.
It's important to ask in layman's terms, because this patient may not know what a bowel movement or voiding is. So now that I have asked her those 2 questions, I'm going to ask, are you in any pain in your stomach at all? Okay, so first have the patient go in a laying down position. And first you're going to auscultate. You're going to auscultate the 4 quadrants. And what you're listening for are bowel sounds. There needs to be bowel sounds in every quadrant. Now, after I've auscultated, now I'm going to do some light palpation of the abdomen. When I palpated the abdomen, it was soft and non-tender, and I didn't feel any lumps. So now I'll do a peripheral vascular assessment, in which I will be looking at the patient's legs. And I'm for the color to make sure that it is uniform, just like before. And I'm also assessing if there's any missing leg hair. If I see any missing leg hair, you could ask the patient if they do shave. So now I'll be assessing the temperature. So the patient's skin temperature is warm, which is a normal finding. If there was any cool, clammy skin, this would be indicative of an abnormal finding, and it could be indicative of PAD, which is peripheral arterial disease. Now I'm also going to be looking at the pulses on the feet, the radial pulse and the posterior tibial, and I'm going to be comparing it on both sides. And I'm gonna assess the strength, and right now it is at a normal strength. You also have to assess the capillary refill on the toes, which is the same thing we did on the hands. You press on the toe and you wait for the skin, you wait for the color to return to normal, and this should return back in less than 3 seconds. Looking at the legs, you're also observing for any edema. This setting, we can take the patient's weight and height, and as they're walking to the scale, we can observe their musculoskeletal system. Observing for their arm movements, that they're moving equally and bilaterally, as well as their legs, and that is assessing their range of motion. And you can also assess their gait and that they're balanced. Now that the assessment is complete, ask the patient if they will be needing anything else. Okay, so then I'm gonna be going. If you need anything, please press the call button to call me and I'll be back in. And as you're leaving the patient's room, assess the floor, that there's nothing they can trip to while walking to the bathroom, as well as having all their personal items next to them.